Hi everybody, welcome to the NMCWatch podcast. Thanks for listening. All of our guests have had a variety of experiences when they've been referred to their regulator, such as the Nursing and Midwifery Council. They've gone through a fitness to practice investigation and often a local employment investigation as well. Some of those experiences have been very positive, but some not so positive. And we hope to give them a safe space in which to discuss those further. Some of our guests will express opinions that we don't agree with. That's fine. They're welcome to share those opinions and hopefully it will create some debate. But although we may not share their opinions, we offer them a safe space in which to discuss how it felt to be referred, how they got through it, and how life is now they've got through the other side. Hi Paul, thanks for joining us. And thank you everybody for tuning in. So we're joined today with Paul Turner, who is a mental health nurse. Paul qualified in 1987 and went on to specialise with the treatment of people with alcohol problems. He left the NHS in 2003, but then did a return to practice course in 2014 in order to get back to treating people for alcohol use disorder privately. In large parts of the UK, people find it very difficult to find suitable and effective help for this disorder, and over 8,000 people a year die from it. There's few resources that are made available, leaving a gap which Paul aims to fill. In 2016, an NHS nurse discovered that Paul and a colleague, who was a nurse prescriber, had been treating a patient with an alcohol home detox programme, and this nurse decided that they shouldn't have been doing that. So she referred them both to the NMC, stating that they were both working outside of their remit. She made no effort to contact either of them, and Paul to this day has never had a conversation with her. The referral was full of evidence of her own shortcomings, really, in regards to her knowledge of the situation and that area of practice. She even admitted to the NMC that she'd never conducted an alcohol detox, despite being employed as an alcohol specialist nurse. The NMC regarded the allegations as both serious, for both of them as serious, and they had to both attend interim order hearings, but at the end of that, they got no interim order placed. A year later, very little had been done in terms of investigation, and the hearing went ahead and they were both concluded with no case to answer verdict. Along the way, there were some very strange events, which I'm sure Paul will explain to us later. He was himself actually asked to be to find a alcohol expert who could advise the NMC regarding this case, because they had no persons in their organisation that could do that. So what an experience, Paul. So there's so many common themes again with some of our members. What happened after the referral to yourself and your colleague?
Well, I was just sitting there one day and my phone rang and it was this London number, and I picked it up thinking it may be somebody who wanted some help with an alcohol problem. It turned out to be a representative of the NMC, a case officer, telling me that there'd been very serious allegations made against me, which at first you think, oh, what could that possibly be? As it turned out, it was about a patient in Manchester who had been he'd started an alcohol home detox that day. He'd been treated before by my colleague, but not by me. And my colleague, he was a prescribing nurse, and he'd written the prescription, and I'd gone and visited the patient. The patient was very anxious. Anyway, this anxiety grew through the afternoon, and he spoke to my colleague, and we sort of, we were sort of basically dealing with this chap's excessive anxiety, until a point where he, for whatever reason, went into the kitchen, picked a knife out of the drawer, and cut his arm.
Oh gosh.
Now, he didn't cut any artery or anything like that, but he did do tendon damage. So he had to be treated. He had to have surgery on the arm for the tendon damage that he caused. And when he got to the hospital, This alcohol specialist nurse had been asked to come and see him because obviously he was having alcohol withdrawal symptoms because the medication had stopped as soon as he went to the hospital. Nobody from the NHS contacted us. Nobody said what's happening with him, what's the medication he's been having, how severe have his withdrawal symptoms been. There was no communication from the NHS, which is pretty typical, really. That tends to happen. But this alcohol specialist nurse asked him, who was doing this detox with you, and rather than contact us and ask us, what was happening, what were you doing, she went straight to the NMC and reported us. She got completely inaccurate information. She reckoned I was running 2 businesses and my colleague was running another 2 businesses, and it just completely, almost like she just decided to make up a story. So I get this phone call basically saying that, it's considered that, whatever we'd done was responsible for this poor chap getting in such a state that he ended up cutting his arm. Now, he'd previously been treated successfully with an alcohol home detox 3 years before and done almost 3 years without drinking since. And there had been no such complications then. He had a supervisor, which was his partner. She was looking after everything, in terms of holding the medication and calling us to keep us updated with what was happening. She had to call us with a blood pressure and pulse before each dose of medication. So there was no point at which she was unsupported. The person making the accusation, the NHS nurse who reported us, said that she'd been left unsupported in a situation where she was expected, with no clinical experience, to assess alcohol withdrawal symptoms, which was completely untrue. All she needed to do was tell us what's happening. Is he okay? Is he shaking? Is he being sick? Is he very agitated? Is his behaviour okay? And she had 24/7 access to us for that. So we were accused of that. And then over the sort of coming days after the initial phone call, we started to see more of the information. More information was sent by email from her to the NMC case officer about what she thought that we'd done wrong. And what was quite bizarre was that the evidence that she used that we'd done something wrong was actually what I was using to put our case that we hadn't done anything wrong. It was the same NICE document. And now this NICE document was about alcohol treatment. Now, it included alcohol detox, but it wasn't only about alcohol detox. So it said things like that a person may be offered 10 sessions of cognitive behaviour therapy. So she read that to mean that should be offered before a detox is offered. Oh, good luck with that on a bottle of vodka a day. So she was coming up with all these conclusions about what we should have been doing. She was also using the policy at her own organisation, and their policy was, if somebody needed an alcohol detox, to basically keep them waiting. Probably related to resources, probably because they didn't have the resources. But they would be kept waiting for weeks or even months, keeping a drink diary, not getting any help at all, or not getting any relevant help. And so she was thinking that must be the clinical way of doing things. And while I was putting together our case, and I stayed quite calm. I was quite arrogant about it. I was quite, we haven't done anything wrong. There's no way we've done anything wrong here. Whereas my colleague was really falling apart. Really, I mean, he prescribed the medication, and he'd had an RCN lawyer tell him that the worst case scenario was that he could go to prison. I mean, this is how things were happening. So he had a much worse experience, and I was too arrogant. I mean, I believed that the NMC was like what I saw the old UKCC as. They get involved if you were nicking drugs off the trolley, or you were, you hit a patient, or you had sex with a patient. But if you just made a mistake, then I didn't think the NMC would be interested in that. But of course, I found a lot more about the NMC mainly through my work with my stuff with NMCWatch. So basically, we were in this situation where we were being accused of all these ridiculous things that just made absolutely no sense. Another thing that was said was that the patient had a child, a 3-year-old child, and that we had put the child at risk by giving him medication, benzodiazepines, which are to calm a person down and stop withdrawal symptoms, that by giving those medications, that was increasing the risk of him being aggressive or dangerous towards the child, which, of course, on her watch, he was drinking. So, and we all know what alcohol does in terms of aggression. So there were completely ridiculous allegations, and it became apparent from the emails that I saw, the emails between the NMC case officer and the person making the referral became very, very friendly. The referrer had recently become pregnant and was going onto maternity leave, and they ended up in the emails about myself and about my colleague, chatting. Oh, good luck! I hope everything goes well with your pregnancy, and I hope the delivery's not too bad. And I'm thinking this is totally inappropriate to have these conversations in emails, which are going as evidence, to possibly to have me struck off. So it was a really, really bizarre situation. And the NMC told me that I'd got to respond by a particular date. So I made sure that everything was sorted, and like I say, my colleague had fallen apart. He really wasn't able to do very much. So I was looking after all of our answers and dealing with all that sort of thing. And over the next few days, I just became more and more irritated by the sort of things that were being said, because I thought this just doesn't make any sense, and she doesn't know what she's talking about. And then it became clear that she'd never actually done an alcohol detox.
Right.
So I'm thinking, why is she qualified to even comment? Why is she even an alcohol specialist nurse? Anyway, so the NMC gave us this date by which we had to respond, and I did the written response. And 2 days before the written response was due to be in, the NMC decided there was going to be an interim order hearing, after having told us, you've got until this date to respond, and then we'll make a decision about whether you need an interim order hearing or not. They made the decision 2 days before the date that I'd been asked to get the report in. I had actually got the report in that day, but they'd obviously ignored it. They weren't interested in it. They just wanted their hearing. Sorry
to interrupt. Were the NMC aware that your colleague was struggling? Were they aware of that?
No, not really. I mean, the RCM were. The RCN knew that he was having difficulty. He ended up seeing a doctor. He ended up being given some benzodiazepines himself, some diazepam. So he was in a real bad state. I mean, he got PTSD. He was, even months later, he was walking into rooms and there were certain smells were reminding him, or maybe it smells that, something he was cooking on the day that he got the referral or something, I don't know, but certain smells were, sort of provoking him or pushing him into this sort of state of panic. So it was a horrible situation, because I just thought, it's somebody's going to ask us a few questions and we're going to say, no, this is what happened, and then they're going to say, oh, okay, then fine, fair enough, carry on, which effectively is what they did do, but not before they put us through horrendous trauma along the way.
Okay. So how, twofold really, you said you were both represented by the RCN.
Yes.
How did they prepare you for the hearing, and how did they did you have a lot of time with them beforehand to be able to get ready for it?
Well, I had a few conversations with a solicitor at the RCN who told me basically that look, this is absolute nonsense. I'd told her my situation. I'd given her all the evidence that I'd collected, and she looked at it and she just said, "I'm just going to ask the NMC to just drop this because it's absolute rubbish." But of course, the NMC didn't listen. The NMC wanted the hearing. My colleague, he had a little bit of a different situation. He had a situation where he couldn't really get hold of his RCN solicitor, and had real difficulty. And then, finally did speak to somebody who, like I say, said to him that, the worst case scenario was he could go to prison.
Gosh.
Which was, completely bizarre. But then when we got to the interim order hearings, and he's based in Wrexham, so he's in Wales, and I'm in England, so he had to go to Cardiff, and I had to go to London on the same day for our hearings. And what the RCN did, which was probably correct, so the RCN decided to treat us separately. Because they didn't know whether or not, I might blame him and he might blame me. So they considered it good. And it was probably good from a legal point of view that they did things that way. But he and I were totally together. There was no disagreement between us at all about what had happened or that anybody was to blame for it. And so we went to our separate hearings, and I got my sort of, no interim order verdict about an hour or two before he did. So I was waiting for him, because if both of us didn't, I couldn't carry on working without a prescriber. It would make my job very, very difficult. I'd need to find somebody else to work with, and I didn't want to do that to him. So he ended up, sort of calling me an hour or so later saying he also got a sort of no interim order verdict. And we were both allowed to carry on working, as we had done before, which seemed like fantastic at the time, because we can just carry on. But it didn't work out like that, because when he went to write a prescription, he couldn't move his hand on the page.
Yeah.
He was so traumatized by the whole thing, he couldn't put his signature on a prescription, which meant the business was dead. That was it. There was no way I was going to be able to continue because I had nobody to prescribe.
So that's quite a shocking reaction, isn't it, to it? But it's probably quite a common reaction in other forms. How other people play it out. Insofar as I think generally members of the public and probably the NMC will think, well, people will be fine because they've not got an interim order. They can just carry on as before. Nothing's to worry about. Get on with your life until it comes to hearing. But actually, for some, that's really debilitating.
Yeah, he suffered. He was quite anxious anyway. He'd be, when we get referrals, I'd say, we'll be all right doing this one. It seems no. He said, I'm a little bit worried about this one. I'm a little bit worried that maybe they're not quite telling us about how much they drink. Maybe they're not telling us the full story. And I said, but that's all of them. They all do that.
Yeah.
And no, I don't think I can do this one. So he was more anxious than me in that way anyway.
So more predisposed to having this kind of reaction to the process. Yeah.
Yes, yeah. So I've never been the sort of person who suffered from anxiety, really, or until this.
Yeah. Did the NMC? I'm just thinking from a safeguarding point of view of the NMC. We talk about it quite a lot on the group, don't we? About whether they do or don't safeguard the registrants going through the process. And I know since your case was quite 5 years ago. Since then, they've introduced the care line, the counselling line. But did they do anything particularly to assess or safeguard you to see what the impact was?
No, they never asked how we were. They never showed any interest or not as to whether we were we were okay, whether we were struggling with it, whether we were traumatized by it. The person who was the first person to really show any sort of compassion from the NMC was the lawyer who advises the panel.
The legal assessor.
Yes, the sort of the barrister who'd been sort of allocated to the case, so I'd only met that day for the first. I've been speaking to the solicitor, and the barrister was there to deal with that, and she told me that she knew him, and she said he's very often very supportive to the registrants. She said so that's good that we've got him.
Yeah.
And when we'd sort of had I've been through the process, which is a horrible process when you can't say anything, and and you're just sitting there while your lawyer sort of does the talking, and your lawyer isn't as familiar as you with the whole thing, so you feel uncomfortable. You think, oh, she's missing something. She hasn't said this. She hasn't said that. But we sort of then went out and waited for the panel to decide what they were going to do. And when we went back in, the lawyer, the legal assessor, whatever he's called, nodded to me and smiled.
Okay.
Came back in, and that immediately made me think that maybe this is going to go okay. And that's when they said that there was no interim order.
So how long was the process from being referred to getting the final outcome?
Very quick.
Was it?
Well, no. It was very quick between the referral and the interim order hearing.
Right.
It was about 5 weeks.
Oh gosh. Okay.
It was really quick. Went far quicker than I expected. Then once we'd got the sort of interim order or the no interim order verdict, then we got what was supposed to be the investigation. So that they wanted all sorts of information, they said. And then the time just went on and on and on and on, and nothing happened. I didn't hear anything from them. There was just nothing. And I think, what's going on here? And I spoke to the solicitor at the RCN a couple of times, and she said, no, haven't heard anything. And then I suddenly got a letter one day saying that they were looking for an expert in who was had expertise in the treatment of people with alcohol problems, because they needed that person to tell them whether or not what we'd done had been reckless or dangerous or inappropriate or whatever. So that's what so I thought, right, okay, well we're obviously waiting for that. And then a few more weeks went by, and then suddenly, and this is 7-8 months since the interim order hearing, and suddenly I get a letter saying, do you know anybody?
Gosh.
So, yeah, my best mate. Yeah, anybody? Can you tell us anybody?
Gosh.
So, well, no, not really. Unless, in the meantime, because my colleague had fallen apart and wasn't able to work, I'd had to find somebody else to work with. And I found a private GP who was already doing some stuff related to alcohol. And I approached him, and we had a chat and got on very well, and still got on like a house on fire now. And he replaced my colleague, so he became the prescriber because I couldn't prescribe at that point in time. So I'd probably been working with him 8 or 9 months by this point, and I just said to him, I said, will you write something? He said, yeah, okay. So this is the bloke I work with, the bloke is also my friend, and he's and the NMC accepted that. They accepted what he said about my practice, and that I keep good records and I'm meticulous in dealing with things safely and that sort of thing. And he said that, and they just said, well, okay, that's okay then. And then I think it was almost exactly a year from the interim order hearing to the final verdict, and they suddenly sent me a letter saying that the patient who they'd finally decided to ask, his experience. I mean, this is a year later. Up until this point, they haven't even before the interim order hearing, they never even spoke to the patient and said, what's your thoughts?
Gosh.
So they contacted the patient, and the patient says, "I'm not interested in talking to you about it." He says, "I don't care." This is the patient's words. He says, "I don't care if the two of them are dead or they've won the lottery." He says, "It makes no difference to my life at all. I'm not interested in talking to you about it."
Okay.
And so they said, "Well, that's it. We haven't got a witness there." So then they came back with, no case to answer.
Okay.
They just didn't have anything on us, because there hadn't been anything. I mean, the original referrer had not been able to give anything that we couldn't answer, and he had nothing to say about it. So that was it. It was just.
That was a year after the referral.
That was a year after the interim order hearing. So it's probably about a year and 6 months in total. So pretty quick.
Pretty quick, yeah. In comparison to a lot of people on our group, that's quite a quick process, isn't it? Really.
Yeah.
So you've been a keen supporter of NMCWatch since we started, which has been fantastic. It was 5 years now we've been going. Have you seen any changes in the fitness to practice process during that time that you've witnessed? Can you see?
There seems to be a little more of well, the NMC tend to think more about the impact on the registrants. I think at the time, I mean, I'm quite. In some ways, I'm quite glad I didn't know some of the stories before I went, because my arrogance and I haven't done anything wrong sort of thing, I was able to feel like that, and I was able to fight it, with the confidence that I wouldn't have had I known, for example, what happened to you and what happened to other people. When I think, that's crazy. How could that happen? Yeah, and if I'd have known that things could be that ridiculous, I wouldn't have felt so confident, and I think that was probably the difference. I think my colleague had known a couple of people who'd been through the process, and I hadn't, and so I was, no way, I haven't done anything wrong. I'm not gonna accept this, and that was how I coped with it. And I know that if it happened again, I wouldn't be able to do that, because I know more now than I knew then.
Right, interesting. Yeah, interesting. Do you think that the NMC have a duty of care over the registrant? Do you think that they should be safeguarding the registrant?
Well, I think the role of the NMC is about sort of promoting nursing and midwifery. I think it's about looking after nurses and midwives. It's about encouraging professional behaviour. I don't think it's just about punishment, but unfortunately, I think the NMC has become just about, how can we come down on these people and make sure that they know who's in charge. And I just find it bizarre. I don't think that a professional body should be like that. Of course, if somebody's done something that really is reckless or dangerous or damaging to the people they're supposed to be looking after, of course the NMC has to get involved. So it's
so if you could talk to the NMC about improving say a case that you've witnessed on the NMCWatch group, or what would you ask them to do better?
Communicate with the person who's being referred. I mean, there doesn't seem to be anything of that. It's just a case of, well, these people said that this is what you did, so we're going to have you at a hearing. My solicitor tried to get the NMC to just drop the things. Look at the evidence on both sides. This is a complete waste of time, and you shouldn't be doing this. You should stop this now. And no, they weren't interested in listening to that. They weren't interested in my views. They weren't even interested in waiting for my views before they decided there was going to be an interim order here.
Right.
They did that 2 days before the deadline.
So do you think that sounds to me more like it's about that we're always told, aren't we, we've got to engage with the process, and it'd be better for a registrant if they do engage with the process. But it sounds more that it's, what I'm hearing from yourself and people is that it should be also a two-way engagement, that it should be the NMC and the registrant, engaging as equally as each other in that process.
Yeah. I think there has to be proper communication. I mean, I have a lot of problems with the way that things are done. I think I have a real problem, and I don't think it's just with the NMC. I think it's generally in society. When somebody gets accused of something and they go to court and they say, I'm not guilty, Yeah, it's like, well, the person's showing no remorse. Well, why should you show remorse if you haven't done anything? If you haven't done anything wrong, you shouldn't have to show remorse. But it's almost like, well, because you've been referred to the NMC, you've got to show remorse. You've got to show that you're reflecting on what you've done wrong. And there seems to be no room for anybody to say, well, actually, I haven't done anything wrong.
Yeah. Yeah.
And that was my approach. My approach when I was when I was referred was, well, I haven't done anything wrong, and I can back up every single thing I did, and I've got documentary evidence, and that's how I fought it. And after that, looking at other cases, I thought that was probably not the best way to do. Even though it worked out okay for me, they could have seen that as arrogance. They could have seen it as no, I wasn't bothered about the process, or I didn't care about whether or not I did things right. But the one thing I've noticed, and I feel like I have to say this, is that when we're in, on the NMCWatch Facebook page, and people start describing their story, about what's happened, I find myself really struggling to read some of the stories, because the way they're worded, I just think if I was at the NMC, I don't know how much time I'd have to be able to go through this and understand the registrant's point of view. And I think that's something that I don't know whether it's a nurse thing or just a general human thing. Yeah, people, when they get in a little bit of a panic, they don't really explain things very well.
Yes.
And I was really, really careful about taking every single point and making sure it was really, really clear. And I know that my colleague's barrister, who seemed to do a better job than my barrister, when he was in Wales, and he said that the thing I'd put together meant there was absolutely no doubt that it was easily answering every single allegation, and there was nothing the NMC could get us on.
Yeah, and I think that's the thing, isn't it? It's understanding, it's helping people in our group to understand who the people are that are going to be reading this information, and what they need from you in order to understand it better. Because I think I was guilty as well. It's very easy to put reams and reams of information down that actually doesn't say very much.
Well, it's very hurtful. It's very hurtful to be told after years of practicing, and you've always considered that you always do the best by the people that you're trying to help. And then suddenly somebody says that what you've done, wasn't the best, and it was maybe dangerous or maybe reckless, or and it's very hurtful, and people react with emotion.
Yes.
And when you react with emotion, you don't necessarily explain things very clearly.
Yeah,
absolutely. And I think that's something that that people really need to get right, because I think, whether it was accidental or what I did and the way I did it, taking every single thing that she said and answering each of those things to show what absolute rubbish it was that she was talking, I think is what worked for us in our case. And unfortunately didn't come back and bite me as arrogance, because nobody from the NMC said that I didn't seem remorseful. The word remorseful or even reflect. I didn't even have to write a reflection.
Right.
Not one reflection. I didn't have to write anything, because I said no, I didn't do it, and that was it. So it was a very different experience to what I think people have had since.
Okay. So it's been nearly 5 years. So how's life been for you and your colleague since then?
Well, he didn't continue working independently. He went and worked for he's still a prescribing nurse. He went and worked for an organisation that treats people with alcohol and drug problems, but doesn't feel he keeps on talking about maybe coming back and doing some independent work again. But I think he probably, as soon as he starts thinking about it, starts to get anxious and decides that no, I'll just stay where I am. And he's doing okay. I mean, he's not in a terrible state anymore. But he does have things happen which remind him of how bad things got. From my point of view, the business actually went from strength to strength. The person I went to work with, the doctor decided he wanted to work with me. He helped me to get through my prescribing course, so I'm now a prescriber.
Brilliant.
Which makes things a lot easier from my point of view, but I still continue to work with that doctor because it's better for my credibility that we've got this, and I can run ideas by him if there's anything complicated or anything I think I need to check this with him. Then I can do that. So that's gone really well, and the business is. I mean, it became during COVID. A lot of people got in trouble with alcohol. And at that point in time, originally, what I'd been doing was I'd been visiting every patient, any person that was referred to me, I'd go and see them. It didn't matter where in the country it was, I'd go and see them. When COVID came around, I couldn't justify potentially taking COVID around the country with me. So, and GPs were starting to do video consultations, and other clinicians were as well. So I think it then became more acceptable. I think previous to COVID, people had said, oh, it's a bit reckless, you haven't even seen them face to face and you're writing a prescription. But because of the way the world changed, it's meant that I've got my mileage down from about 25,000 miles a year to about 5,000 miles.
Yeah.
I still do see people if I think there's a reason why if somebody's a little bit medically complicated and I think, well, I can't really do this with just a video, I need to see them face to face and examine them, then I'll do that. But that's not the case with the majority of people, so it's changed the way I do things. It's meant that whereas before if I got a referral from Glasgow and a referral from Cornwall, there was no way that I was going to be able to do them both on the same day, whereas now with a video, it's possible I could do the get the two started on a detox on the same day.
Big difference, yeah. So I mean, addiction's a really complex issue, and as we know from members of our group as well, healthcare workers are just as susceptible to it as any member of the public. Do you feel that NMC needs to deal with this health aspect? Do you think that they do deal with it appropriately? Do you think there's anything more they could be doing?
I don't think that alcohol. I mean, I won't get into drugs. I'll talk about alcohol because that's my specialism. I don't think that the NHS or the NMC or the general public or anything treat people with alcohol problems fairly, because there's always this idea that this is somebody's fault, and it's not their fault that they've got this disorder. Their body reacts differently to alcohol to what other people's does, and we all throughout at some point in our lives have a drink, and the vast majority of us don't get into trouble because we're lucky, because we don't suffer from that medical disorder. So when a person does, it's scandalous that these people are treated with shame and blame, and they sort of that people believe that they're not responsible people. I'm treating people who are running massive businesses and who are perfectly okay. They're paying their bills, they're keeping their marriage going, they're bringing up their children, but they're having to have a drink to do it, and it's a horrendous illness. So my view of it is that it's really very, very unfair, and there is a treatment method, a medical treatment method, which is extremely effective, 78% success rate, that the NHS is completely ignoring.
Right.
If the NMC were to be told that somebody turned up to work with alcohol in their body, the chances are they're going to be either sanctioned in some way and possibly struck off. When it's a medical disorder, if somebody turned up for work and their blood sugar was low, nobody's going to sack them for that. Nobody's going to say, right, okay, you've got to be struck off because your blood sugar went low.
I guess the difference, though, is that the consequences could be disastrous, couldn't they, for patients if somebody turned up to work?
Possibly, but also if somebody turns up with low blood sugar, with low blood sugar. I'm diabetic, I'm on insulin, and when I look at something, when I try and read something, if my blood sugar's low, the words jerk around on the page. And it's possible I could read something wrong, I could read a dose wrong. So there are lots of illnesses, depression or other mental health issues, drinking, taking drugs. There are lots of things, but it's and I'm not saying that people should be allowed to turn up to endlessly.
No, I understand what you're saying.
Drunk. But when once it's discovered that somebody's got an alcohol problem, then it should be said, right, okay, you're off work, you're going to get treatment, rather than we're going to discipline you.
Yes, yeah. Right. So one of our other people that we interviewed looked at we discussed whether the problem lies with NMC as a regulator per se, or those referring, or whether it's just regulation in full. And as you know, there's a big piece of work going on at the moment to review all of the healthcare regulators and hopefully bring them together a little bit more, and try and make them a bit more consistent between how they're all working. Have you got any views on this at all, or how you feel regulation perhaps should change or not change?
I think there's a problem in society, and there are people who, whether it's through social media or whether it's through going through official channels and reporting people. I think we just have a culture now where there are quite a few people who believe that it's okay to cause problems for other people. And in certain cases, I know that with my referrer, I personally believe that she just thought, oh, I'm being a hero here. I'm reporting these terrible men who are taking advantage of people. And, because we work in privately, it makes it worse. And it's almost like, I'll make myself look good by reporting. And then, of course, you've got people who are running, businesses like nursing homes and that sort of thing, who are thinking, well, that person's complaining about the staffing levels, so we'll get rid of them.
Yeah.
We'll report. We'll say they gave the wrong drug to a resident, and you've got that sort of thing. So my problem with the NMC is that there are no sanctions for anybody who is discovered to have lied. So you can make up, and it's not just with the NMC. It's in life. If I go to the police and say, you punched me in the face, yeah, they'll come and arrest you. Yeah, and that'll sort of that'll sort of go with you, and you've got to prove almost that you haven't done it by having an alibi or whatever. But and people do seem to be able to just make allegations, and then when they discover it's absolute rubbish, she didn't hit him. Yeah, there's no consequences for me. They just say, oh no, she's found not guilty. End of. And I think that's appalling. I think if somebody's making up lies about somebody, I think they should be sanctioned, and particularly when it's a registrant,
yes,
who's reporting another registrant, and it's all in the code of practice about honesty and professionalism, and then you've got a nurse who thinks, right, okay, I'm going to cause trouble for that person because I don't like the look of his face.
It's tricky to unpick it though, isn't it? Because like you say, that nurse that referred you may well have thought that they were doing it for the right reasons. I know
you'd check what was going on. You speak to the person you were going to refer, wouldn't you, and say, what were you doing?
Yeah, you think that you would. And
she doesn't know anything about me. For all she knows, I might be the nicest bloke in the world, or I might be the worst bloke in the world. She doesn't have a clue who I am, or who my colleague is.
And it's about those conversations, isn't it, and how those conversations are managed as well, I think, which is missing really at the moment, I think. Yeah.
Yeah. I mean,
I think you're right.
What I would have liked would have been to have gone to a hearing and had her standing there saying what I was supposed to have done that was wrong, and me being able to answer and saying why I did what I did. Yes. That would have been perfect for me. Because honestly, there's no way she would have been able to convince anybody that she was right.
Yes. Thank you for that. So have you got any advice for a nurse or a midwife that might be struggling with some level of alcohol issue, perhaps doesn't realise particularly that it's affecting their work, or perhaps it is affecting their work and they don't know where to go? Have you got any advice?
Well, I mean, a lot of time you see stuff in the media, you see the tabloid newspapers talking about, if you drink this amount, then you're an alcoholic and all that. It's a word I hate. I hate the word alcoholic. I don't use it. But that's the word that tends to get used. It's not about how much you drink. It's about what happens when you stop. Yeah, if you can't stop drinking because your body demands more and more alcohol, then you're in a life-threatening situation. Because if you're having to have a drink because you're going to work and you think, oh, I've got to have a drink now because I've got to get through an 8-hour shift and then I'll have another quick sip at lunchtime, and you're doing that sort of thing, then your body is dependent on alcohol, and you really need to do something to get it sorted. And suddenly stopping can be dangerous. It can kill. So people need to get medical support, medical help, and do something like an alcohol detox. So it shouldn't be ignored. There are other types of drinkers who are just binge drinkers, so they don't drink all week while they're at work, and then all of a sudden they'll start. It comes to the days off, and they think, oh, that's great, I can have a drink now, and then they'll spend 2 days getting absolutely hammered, and then stop drinking again before they go back to work. And again, there are treatments to get that under control, but it's not something that you can just say, well, I'll just ignore it. It doesn't matter. I'll just have a drink and then I'll be all right.
So get help, basically.
Yes.
Yeah, speak to somebody about it. Yeah. Okay.
Yes.
Okay. Thanks so much. Really great to talk to.
Right.
I could talk to you for a long time, but I'm sure a lot of people listening would get great comfort from hearing what you're saying, and also the similar themes with their own cases as well. So thank you very much.
Yeah, I mean, the most important thing in my view is when a person gets referred, they've got to look at exactly what the referral says and answer exactly what the referral said. There's no point talking about all the other things that people say and all the emotions come into it, and you've got to answer the allegations.
Yeah. Thank you, Paul.
All right, thanks.
Okay, so we hope you enjoy listening to us, and we'll look forward to hearing your feedback soon. Bye.